President Bola Tinubu in the health and social welfare sectors. Dr. Tuyi Mebawondu joins me. He is a public health practitioner. Dr. Mebawondu, what do you make of this new appointment? Would you say we have round peg and round hole, especially if you look at the appointment of someone like Dr. Olajide Idris to handle the NCDC?
It's quite exciting. I'm seeing a very impressive appointment because if you remember, Dr. Olajide Idris was actually the health commissioner in Lagos State for close to 20 years, and before then he was the permanent secretary in the Ministry of Health. During his tenure, we saw two cases of pandemics. One, the Bola, which was excellently handled, and then of course we saw also the COVID-19 that came in while he was still there. And in all this, he has shown himself to be quite a very competent person in those pandemic handling. And he's done a lot of work in that regard. He represents an institutional knowledge that must not be lost, that must be passed down to the federal center and even to the Africa as a whole to enhance response to pandemic. If you observe now in the world, we are seeing more of pandemics and diseases jumping from animals, jumping from other things to humanity. And then we are looking at ways to respond to them. Even in Davos, we saw the play of another disease that might really come the next epidemic. Dr. Olajide Idris, as head of Nigeria Center for Disease Control, is a proper fit for that role, and I'm sure he's going to deliver. He's not new to the top. His experience, he has the requisite knowledge and the strength to go the health. And also, if you look at it at the level of the Medical and Dental Council of Nigeria, we saw Fatima Kiari. We saw quite a lot of people that have the hybrid education, both abroad and in Nigeria. Dr. Idris was in the University of Lagos before going to Yale. Fatima was in the ABU before going to London School of Tropics and Hygiene. These are people that can actually pick knowledge from over there or to use here, or even pick knowledge from here to deepen what they have learned abroad. And then we saw also that Superintendent over the health is Ali Pate, a well-known personality, in the health community worldwide. So I'm looking for a synergy. That is what we are going to be looking for now, a synergy between all of them to work together to ensure that they deliver the right health outcome for the general people in Nigeria.
NAFDAC, Professor Mojisola Adeyeye, has been retained. What's your take on that?
Well, she's been on the duty. She's been there before, retained, but now she has another board that can look at what she's doing and support her. But of course, you cannot take that away from her. If you look at her bio profile, I mean, it's quite impressive. A lady who's been there, working abroad, working on pharmaceutical, working on pharmacovigilance and all those stuff. I'm sure this one is going to, strengthen her to deliver more, especially now that we're facing challenges of manufacturing in the pharmaceutical sector and faking of majority of the drugs, and then issue of patents being withdrawn, company moving away from Nigeria. It is important that we have somebody who is actually very active at the level of National Agency for Food, Drugs, Administration and Control to be able to monitor our drug production at this particular time. And she's quite fit to do that.
Public health practitioner Tuyi Mebawondu, thank you very much for talking to us on TVC News at 7.